February is American Heart Month, and I'm here at Row House with Melissa and Pauline to talk about the benefits of cardiovascular exercise for the heart. We know that cardiovascular exercise helps reduce the risk of coronary artery disease, improves blood pressure, strengthens the heart muscle itself, reduces blood sugar for those who are pre-diabetic and diabetic, reduces anxiety, and so many other benefits. So we're here and turning the time over to Melissa to talk about one of the best ways to do some cardiovascular exercise, which is rowing.
Thank you so much. Yes, we love rowing for cardiovascular health here at the Row House for a number of reasons, and I kind of wanted to walk you through a few of those. The first reason that we love rowing for cardiovascular health is that rowing utilizes 85% of our muscles. So I'm going to walk you through the row stroke a little bit and show you where we're getting that number of 85%, because as you know, the more muscle use you have in any given exercise, the more that you need oxygen, and that heart muscle has to pump the oxygen to the muscles in order for them to work properly. So we want that 85%, that's great. And let me show you where we're getting that 85%. So Pauline, go ahead and pick up your handlebars. And when we start the rowing stroke, we start at the front of the stroke. And rowing is a leg dominant stroke. So 60% of the effort of the stroke comes in the legs, the quads, the glutes, the hamstrings, and the calf muscles. So as we start this stroke, this is where the power begins. She's going to start by just pushing with her legs and dropping her knees down. So that's where the power is, and that's 60% of your power right there. Next, we're going to use the core of the body, both the front and the back, to lean back. That's going to continue the power that the legs started and bring it into the back muscles as they pull backwards. The core is now catching her at the finish, so you've got that belly engagement as well. The last thing she's going to do for the last 10% of our effort here is pull the arms in and they hit under the chest. So that's working your delts and your biceps and your triceps and your back muscles all at one time. That is all one movement, and it's a quick and powerful movement to the back. And then as Pauline comes forward, she's just going to recover on the way in. That gives your body a chance to reset. The oxygen gets back to the muscles, and then we start that drive back again with our legs, body, and arms. So 85% right there of muscle groups working. So that's the first reason we love rowing. The second reason we love rowing is because it is low impact. We could do this for a very long time, and we're not jumping, we're not putting extra stress and strain on the joints. All we're doing is asking those muscles to work harder in a way that is sustainable over time, that you can do a lot of and for long periods of time. And the third way that we love rowing for cardiovascular health is that it's effort-based. So we do two kinds of rowing here at the Row House. We do nice steady state cardio here, where that's going to build that heart endurance, that's going to help the efficiency of the heart. The second thing that we do is the high intensity interval training, where we take that heart rate way up and go strong and fast, and then we bring it way down to give the heart a chance to recover. And that is really going to work on metabolic changes in your body, help your metabolism work a little bit better, but also just really build that heart muscle even more. So we love rowing. We think it's an amazing workout, and it's for any age, any fitness level, because it's effort-based. You put into it what you want to get out of it, and if you want to push a little harder, you're going to get a little more cardio benefit out of it. If you're going to take it a little more steady, you're still going to get cardio benefit. It's just going to be a little bit different.
Perfect. Well,
Yeah.
thank you so much
for
sharing, and we appreciate your knowledge and help with this.
Absolutely. Appreciate it.